Good afternoon. I'm Dr. Vivian Johnson, Senior Vice President of Clinical Services at Parkland Health and Hospital System. I would like to welcome you to Parkland's first virtual Coming Together for the Cure educational series. We've traditionally had this event in person, but due to COVID-19, rather than cancel the event, we decided to pivot and have the information brought to the community in a different manner. Now, here at Parkland, we are dedicated to the health and well-being of individuals and communities. Therefore, today we are excited to bring a series of breast health educational sessions to you. Today, we have 3 clinical experts who will provide important information on the emotions tied to breast health. We will also be broadcasting this live on our Facebook page. If you have any questions, please post them. And at the end of this session, we will have a Q&A session with the panelists. We will also provide you the additional information about the upcoming sessions for this week at the end of today's presentation. So without further ado, let us begin by introducing to you our panelists. Our first is Ms. Myra Martinez. Ms. Martinez is an experienced mental health counselor working with a diverse population from different age groups and in different work settings, ranging from clinical to nonprofit-based settings. Her concentration is in mental and physical health, with a specialization on trauma and crisis intervention. Her specialty areas of focus are working with clients to help alleviate stress, depression, anxiety, and any other emotional disturbance. She strives to ensure that her clients reach optimal, stable, emotional, and mental health. Our next speaker is Ms. Charity Woodard. Ms. Woodard is a licensed master social worker currently working in Parkland's oncology department. She earned her Bachelor of Science work and Master of Social Work from the University of Texas at Arlington. Ms. Woodard began her career in Child Protective Services in Tarrant County. She has worked in the field of behavioral health for the past 3 years. She is passionate about helping people achieve health and well-being in every aspect of their lives. And last, Dr. Iwa Sober. Dr. Iwa Sober is a licensed psychologist in the state of Texas. She earned her doctoral degree from the University of Texas at Austin and completed advanced training at the Veterans Administration Center in Memphis, Tennessee, and in Houston, with a focus on health psychology. She is currently an assistant professor at the University of Texas Southwestern Medical Center and the psychologist for the oncology outpatient clinic at Parkland Health and Hospital System, where she oversees the Department of Behavioral Health Program. I introduce to you our panelists without further ado. Thank you.
Hi, good afternoon. Thank you everyone for joining us. So we will commence the Coming Together for the Cure presentation. Just a couple of guidelines before we get started. Upon joining in, please mute yourself. The meeting will be recorded and live streamed on Facebook at Parkland. All comments and questions should be typed in the WebEx chat function, and all these questions and comments will be monitored on Facebook. And as Vivian mentioned prior, all the questions and comments will be answered at the end of the presentation. Okay, so we start talking about the emotions tied to breast health, and what I love about it is that we will dive a little bit into the mental health, but more in specific, the self-esteem piece of what goes on when you're going through a breast cancer journey. We will dive a little bit more into information, but then we expand on, well, what can we do? What can we do when we've realized we are struggling with our self-esteem? So I always love to start with a quick definition, and for those that are a lot more familiar with depression now, and you know, we think that there's a lot of information out there available for our patients describing the signs and symptoms of depression, but I purposely picked out a couple, so this is not the full criteria for depression, but a couple of points because I wanted to expand a little bit further into the complexity of depression. I think it's all important because we usually think of a stereotypical vision of, oh, if I'm crying, if I isolate, I stay away from my family, I'm inside all day in my room, then I'm depressed. But what we know is that depression can be more than just that one phase. So I start off with, persistent feelings of sadness, emptiness, hopelessness, guilt, worthlessness. Oftentimes we associate depression always with sadness, but we never think about the guilt that comes with it, the worthlessness, the feelings of not feeling worthy that stem and start hurting our self-esteem. But that's one phase. Another phase is loss of motivation, the loss of feeling pleasure and joy in the things that we used to love doing. We lose a sense of ourselves. We lose part of that joy when we're feeling depressed. Then we get down to restlessness. We're feeling anxious. We have uncertainty feelings. We start feeling it in our physical body. And then the other phase that maybe not a lot of people think about is irritability. It's anger. It's feeling judgmental and sometimes becoming cynical. So if you're a family member or a caregiver, and your family member is going through breast cancer and you start noticing them angrier, judgmental, oftentimes that's our way to self-defense from the feelings of depression, right? So we look at this, and the perfect way I love to describe it is for those mamas out there and patients that have watched the movie Shrek, there's a quick scene where Donkey goes up to Shrek and says, "Why aren't you like everyone else? Why don't you feel like everyone else?" Shrek turns around and describes himself in a perfect way that I'll continuously use this analogy throughout the presentation is, he says, "I'm like an onion. I have layers." And it's the same for depression. There are multiple layers and emotional layers that come about it. And I do explore that further in the next following slides, but just to present it to you and so that you're aware, depression isn't just someone crying in the corner in their room. It really can be someone in denial and expresses it and hides behind anger and may come off as rude, but deep down when we start pulling away at those layers, we start noticing it's depression, or sometimes it's something else. We end it with thoughts of death or suicide, and this comes up often, and I think it's important to talk about it because at least for patients that come here, you're constantly asked if you're having these thoughts. And I remember when I would get called in, and Charity, maybe even now that you could think of, I would get called in and I'd go in and say, okay, they're worried that you're sad. Doctor, saw that you're looking different, you're feeling different, let's talk about it. I would either get yes and get that full vulnerability from them and them feeling comfortable and saying, yes, I'm struggling with these thoughts. But then the other chances I would get anger. I would actually be received by anger and be told, no, I'm not depressed. I'm not suicidal. I'm fine. But the more we dive into it, I often saw this wall of this cultural definition of, if I admit that I'm struggling with these thoughts, then I admit and I'm putting a label of myself as crazy. And so we want to break this cultural belief that no, this is not normal to feel. We want to be able to be a supportive pillar. We want to be able to, for you to be able to be comfortable to when you go into your appointments and you admit to having these thoughts, know that there's a team backed up and prepared to help you with this. And I know Charity gets called on a lot for these kinds of things, but we are essentially there to help you through these struggles. But essentially overall, the purpose of this slide really was to help you see that there are multiple phases than depression, and we'll further explore what that looks like in a little bit. So we dive into psychological effects. So we've talked a little bit about depression. It's often accompanied by anxiety, and we talked about anger. So we have to remember anger is a defense mechanism. So it starts off with this emotional piece. This is triggered by when you're first given the news of, hey, you were just diagnosed with cancer. We think it's cancer. We need you to come in. So this is the automatic response that's felt. But what we often don't think about is how these emotions start triggering specific thoughts. And it's what we call cognitive distortions. In other words, unhealthy thought processes. So what it looks like is you move from feeling depressed, feeling anxious, to now you're thinking, oh my gosh, I won't be able to take care of my kids. Or if you're the sole breadwinner for your family, I won't be able to pay the bills. Life is going to look so different. Or, oh man, I need to go and tell my family because this is going to change my life and I'm going to have to lean on more of them. I might become a burden. And you start self-doubting absolutely everything. You start putting yourself these negative connotations that are just very unhealthy. And it's that negative self-critic that we will continue to explore further on. But it doesn't just stop there. It starts converting into what we call maladaptive beliefs. And the way we define this is, as human beings, we start creating beliefs of ourselves, and it's attributed to certain things that our parents teach us, right? But when we have thoughts like, might be a burden, this belief starts shifting everything in you and starts saying, no, I think my family's going to struggle. This maladaptive belief starts converting your core values into negativity. And it starts saying, I am a burden. I'm not a good mom. And you start going through these phases of realizing, wow, like my whole mindset is shifting based on this one piece of news that I was given. So we start seeing how through the psychological effects, you start plummeting and you start digging a deeper hole. When we move further down, we start seeing it's compiled. So with this thought process, with this emotional and belief system that we're now creating of ourselves, we now start looking at, wow, my self-esteem, I'm no longer confident in who I am. I'm questioning who I am. I am not the same. I don't feel the same. So who am I during this journey? We start seeing the impact of this low self-esteem, and it does start affecting our relationships. For some of us, we have family members at home, but we are not welcoming them in our pain. We don't welcome them in our journey. We want them away because again, that maladaptive belief of, I don't want to be a burden. And that's heavy on the heart because you're keeping everything inside. When we push further, right, we level to this part where, wow, you were just given your treatment plan and you were told you're about to go in for surgery and have a mastectomy, maybe double mastectomy. So we start seeing that there's body image issues because our eyes are now seeing the impact of what this journey has on our bodies. We start seeing absences of parts of our bodies, and what this does is it immediately challenges our femininity, our ability to identify our gender, because a lot of us correlate with our body shapes with who we are as a woman. And so we start seeing all of this, and again, it's compiling emotions, thoughts, core beliefs, low self-esteem, and now we see, and we're looking at ourselves in the mirror, and we don't recognize what we see. Which brings me to my last point, and the most meaningful one, is that often this goes unnoticed, is that now we're looking at self-blame, shame. And the way one of my favorite researchers, Brené Brown, defines shame is an intensely painful feeling or experience believing that you are flawed, therefore unworthy of love and belonging. And the way we break it down, we feel that. We think we're flawed. We start looking at all these effects and all these changes. Our body feels exhausted. Our thought process, our negative self-critic in there is just hitting us, punching us, one thing after another, calling us all of these different things, which now we define and we're believing. So this is where shame comes in and says, and I should define the difference between guilt and shame is, guilt is, oh, I did something bad. Shame comes in and says, I am bad. And shame for most of us looks like shame of not being able to make meals for my kids this week. Shame is not being able to pay attention to my partner and listen to his day. Shame is my partner left me. For a lot of us, we struggle with different things of what goes on in our lives, but this is the part where shame sits. And when we let it go and notice, it just grows and grows. So on this next slide, I mentioned a little bit earlier of emotional layers. And so I'll admit, this is actually like my favorite part of the process, because we've now looked at, okay, well, I know what depression is. I know what I'm struggling with. I know that, okay, I'm looking at all the effects, and yes, I struggle with all of this. But the number one question that I get from patients and clients that come into a session is, okay, I'm in my pit hole. I'm in my pit hole from everything you described, and this is where I'm at. How do I get out? And this is where I mentioned, Shrek's layers. We talk about layers, but the most important piece is vulnerability. And the way vulnerability is defined, and again, my famous researcher, Brené Brown, defines it as vulnerability is a risk. It's an emotional exposure. Let that sit in. Emotional exposure. That is pretty scary, especially for you introverts out there who are like, no, I'm not letting anyone in. This is my pain and my pain alone. And it's just sits there. Now for my extroverts, it's like, no, I like people. I like being around people. I don't mind sharing a couple of things. Your challenge is going to be, well, how authentic are you with your vulnerability? Because what we find oftentimes is that we may share a little bit, but there's that fear. There's this piece of fear that's pulling us back and not letting us be completely vulnerable. So when we are thinking about breaking through that shame, getting out of our pit hole, the first step is crucial. It's important. It's being willing to be vulnerable, and it's having the willingness to take that first step. And don't get me wrong, vulnerability is scary. It's so much easier to numb it, and people numb it in different ways. We talked a little bit about how anger is a secondary emotion. Oh, it's so easy to just numb and not deal with everything that comes with it. But by doing so, by neglecting us being vulnerable, we're rejecting joy. We're rejecting the possibility of overcoming what we're feeling. And so when we start piecing all of these things together, we see how vital vulnerability is. And vulnerability is so powerful. And the way, again, Brené Brown defines it as vulnerability is the birthplace of love, belonging, faith, and courage. And it's the first step. It's so scary, but it's the first step. Which brings me down to my next point is courage. And the way courage was defined was at core, the beginning of the word courage comes from a Latin phrase. And what it means is sharing your whole heart with someone. But it's sharing your whole story wholeheartedly and being willing to share that with someone. So in other words, it's storytelling. And this is such a vital point, because at this point, it's not just storytelling. This is how processing starts. This is how we take a step forward and not backwards. This is when these feelings of shame are confronted with courage and empathy. And empathy I do break down in the next slide, but it is faced with these other vital emotions that we often neglect and we deny. When that happens, then we start seeing the last phase, and we're breaking shame. We're breaking through these barriers. So if you're someone who's currently thinking, man, I don't feel like I'm good enough, which we live in a culture of like not good enough. And so this is normal. What we want is that risk. Again, vulnerability is that emotional exposure, the courage, because we're wanting a change. We're wanting to shift the habitual cycle that was created since the minute you were given that diagnosis through treatment, and even now. We start defining ourselves differently, but now we're breaking that view. We're breaking shame. So I talked a little bit about empathy. So this is where I get asked a lot, well, how do I create empathy? I don't even know where to start. The first key point is being compassionate. And that's heavy, because when you're going through a journey, I see a lot that we're not putting ourselves as priority. We're coming to our appointments, but we're not putting ourselves as priority. We're still thinking about other things. Our negative self-critic is here telling us, no, you're this, you're not good enough for this, you're not good enough for that, your body doesn't look good enough. And so the first step of overcoming something like this is being compassionate. And the way it's defined is it's broken down into 3 steps. The first piece is understanding. First is understanding exactly where you're at right now. What's your reality? What does it look like? You know, do you know the signs? Do you know if this was something that started with the diagnosis, or did it start before that? And when we start recognizing these symptoms, we're able to actually process and understand ourselves. Because, and oftentimes I did see when I would get called into exam rooms, is that patients would come in and say, you know, I've never really loved myself. And now it's so much harder to love myself because I see absences. I see that I don't look the same. But this is where we start. We start understanding your past, understanding your current reality, understanding your pain, which falls into this next step of accepting. It's important to differentiate that this isn't approval of what's going on. This accepting phase is important because we're saying, okay, I'm going to accept that this is my reality. No more denial. No more of that anger. We're going to push through these emotions. We're accepting that, you know what, my body doesn't look the same. We're accepting that I don't feel the same, and I probably won't be the same, but that's okay because we're growing out of that. We're going to push forward. So acceptance is important. And the last one is really heavy, and when I bring it up, I say forgiving. Now, I don't say, let's get ready and let's jump and let's start forgiving others. It's important for us to know that there's a difference. We start with forgiving ourselves. With all of these negative self-critic thoughts and beliefs that we told ourselves throughout our journey, or even the beginning, or even towards the end of your journey, we want to forgive ourselves. And it starts off by simply acknowledging the pain that we told ourselves. We start by saying, I'm sorry to ourselves. And it's heavy, but it can be done. And so when we think about, okay, well, how are we breaking shame? We start looking at the steps, and it's understanding, accepting, but forgiving. That they're all put together, but they're all essential. And that's how we start creating empathy. And that's how we start moving forward. And we're breaking that shame. We're breaking through from those psychological effects that we were feeling heavy in the beginning. Seeking help. So we talked a little bit about educating yourself about signs and symptoms. Yes, it's important to know where you're at. It's important to know if I'm just angry all the time, explore that anger, because it could be that what sits is denial, and that's just hurting. It's hurting you, and we see it. Part of the vulnerability is being able to push, and again, reminding of a risk. It's a risk, it's emotional exposure, but we want that. So educating yourself about signs and symptoms is the first step. The second step is what I hope that most of you know about already, is utilizing your team for support. We have a great behavioral health and a social work team here that are equipped and are ready, but more than anything, they're willing to help. There's a willingness that they're just here to help you through this. Now, if that's a little bit intense and you're not ready to talk to your doctor or provider about how you're feeling, I guarantee you a lot of our providers can start picking up on signs, and they know you so well from all the appointments that I've gone through. They will point it out, but if that's a bit too scary, then that's okay. The next step is join a support group. And in the next following slides, I do provide a list of some support groups if you're not in one already. But it is vital to start exploring and building our support system. Which brings me to my last one, is ask for help from significant others. So I get told a lot of, you know what, I don't have anyone in my support system. I'm alone. Or my spouse left me and my kids don't talk to me. What can I do? And so when we look at situations like that, we create empathy, but we also start exploring supportive pillars elsewhere. Your doctor is a supportive pillar. Oncology team is a supportive pillar. Finding a counselor, social worker is a supportive pillar. We start looking for different avenues of how to create the support that you need to be able to get through and get you back on your feet when you're feeling good about yourself with your new body. And it's, I know we talk a lot about, this journey is definitely not made for you to be alone. It really is a time for you to explore, okay, how do I create a support system? Because this is hard. This is absolutely hard. And we don't want you to go through the easy path. We don't want you to go through, well, I'm just going to be angry. I'm just going to numb everything. We don't want that for you. Part of seeking help is being, again, vulnerable, pushing through that shame, but more importantly, being open for help. So I did think about a couple of mindful tips, something that, does come up often in sessions, and we explore different things because, again, I always get asked, well, how do I do it? How do I get out of my pit hole? And simple steps, right? If you're currently healing through surgery, if you're currently just going through chemo and you don't have the energy to really go out and move your body, then let's do things like meditation, grounding techniques, deep breathing. These are things that are there for you to utilize to be able to help you cope with what you're feeling. And what this does is inadvertently it starts pushing back at that negative self-critic, and it's saying, no, I'm a priority. I'm putting myself first this time. Another one is practicing positive affirmations. And as cliche as this may sound, it really works. Because again, reverting back to the psychological effects is we have this cognitive distortion that convert into beliefs of I'm not worthy, I'm not enough. And this is challenged because with the positive affirmations, the first step is I don't need you to believe in it, I just need you to say it. I need you to say it enough to where eventually it's a belief. And we convert that back to the original core belief of you are worthy and you are enough. And we're destroying that shame. Practicing gratitude. A big part of being compassionate and having empathy for ourselves is sharing gratitude, practicing it every day. And it doesn't have to start big. It doesn't have to be something like, well, I appreciate my whole body today. No, start small. And we want small dosages because this is how we create that new habit, the new healthy habit that we're wanting to replace all of that negativity away. Lastly, be kind to yourself in your healing process. Your healing process differs. Everyone's situation is very different and unique. But more importantly, it's just important to continue to remind ourselves we have to be kind. We have to exercise that. Because at the end of the day, no one's going to treat us like we are. And our negative self-critic is so powerful. But our kindness and our own self-gratitude is much more powerful. So in the following slide, I do have a couple of supportive resources. Now, these are a couple of things that we used before. If you're looking for something in Spanish, the first option, Cancer Support Community of North Texas, is really helpful. But when we talk about support groups, if you can't leave the house, that's okay. They have virtual options, but it's creating that support system that we're needing to be able to fight this current battle. I went ahead and included a list of podcasts that are available that I thought were really helpful, things that could help you at least get started, because at this point we're looking at a starting point. And then at the end, of course, just any emergent phone numbers that are available to use as needed. These are, if you're someone struggling with suicidal thoughts, don't just sit in it, ask for help. And if going in person is a little bit difficult, then let's explore some of these phone numbers. Okay. That's pretty much of a wrap up. Thank you so much, and we'll answer a couple of questions now.
Okay, so we do have some questions. The first question is, how does dealing with these emotions impact recovery, and can it change outcomes?
You heard that? Okay, did everyone hear that? Okay, so the question was, how can we deal with the emotions and
how can they impact your recovery? Can it change the outcome?
Oh, yeah, absolutely. So if you're someone who is struggling in just all of everything that we mentioned, and if it goes unmanaged, thank you. If it goes unmanaged, absolutely, it can impact your recovery, because now while your body's healing, the emotional part isn't processing along with your body. So of course, and you start seeing it bleed into your relationships. You start seeing it affect even work, different areas of your life. So absolutely, if this goes unmanaged, it can affect your recovery. Now, if you do address it and you get connected with your oncology team and you get some of that help to help process, then absolutely it does make a huge difference, because at the end of your journey, you don't walk away just feeling everything that you've denied throughout the journey. I mean, you are walking truly in a better light, and not so much of a deeper hole that we've dug in the beginning. But Dr. Wasobo, do you have any other comments?
I would just add that being in a state of depression can definitely impact your willingness and motivation to adhere to treatment. You may find yourself kind of losing hope that you can get better, which might affect, showing up for your appointments and things of that nature. So it is really important to get support so that you are committed and keep your motivation level up to go through the whole journey.
Okay, and the next question is, I didn't realize some women deal with shame as a part of their cancer journey. Why is it an issue for some?
Why is shame an issue? Well, of course, so we revert back to what shame means, right? And it's what it means is just intense, painful feeling of believing that we're flawed. And so when we're now looking at ourselves in a mirror, a lot of women do associate body parts to their identity. So it challenges all of these beliefs. And so, of course, you're walking away with, oh my goodness, like I'm flawed, I'm different. And that inadvertently just starts this thought process of, I'm not worthy enough. I don't deserve my spouse. I don't deserve what I currently have. So yes, shame is a big part, because we start taking everything and we internalize it in an unhealthy way, but shame is a huge part of that. Any other questions? Yeah.
Okay, so how can family members and loved ones support those who have been diagnosed?
Yes, and Dr. Sola, I'll share this question with you. So what are some steps that we could do to help and support family members that have been diagnosed with breast cancer? So absolutely. So a lot of it is simply checking in. The patient, at the end of the day, if they're not willing to open up about their pain, they're going to show you resistance. And that might look differently. That might look like someone who's angry, or that might look like someone's just completely dismissive and ignores our certain family members and pushes back. But a big part is continuously showing that you are there and you're not leaving. I think it's so important to show that you will be consistent in this journey of uncertainty, that something stays the same and their support does not change. But Dr. Ozo, would you like to add anything else?
Yeah, that is very crucial. Just showing up, being present, checking in. You really do have to have a frank conversation with the person diagnosed with cancer, because everybody wants to be treated differently. I've had patients who just want to be treated the way they've always been treated. They don't want things to change. They want a sense of their independence, autonomy. And then there's others who do want more support, but are afraid to ask for it because they have always been so strong, right, for everyone else. So it is important to have frank conversations with them and say, I need you to help me help you. Let me know what it is that I can do to best support you during this journey. And you may give them examples of, I can be there during appointments. If you want, I can help with chores. But if you don't, that's okay. Always keep me up to date if anything changes in terms of how I can help you. You can also let them know or ask them, please let me know how often I should check in with you about updates, because some people feel really exhausted having to go through this process and then turn around and update their family. That's a lot. And so they may maybe prefer just to have a family meeting and update everyone at the same time. Maybe consider yourself being a point person for that person and other family members, where they're not having to do a lot of work in terms of sharing and explaining to others. So I would just have a frank conversation with that person and see how you might best support them.
Okay.
Okay, so we'll have more discussions throughout the week. Part 2 will be physical health, diet, and exercise related to breast health. And that'll be on Tuesday, October 20th from noon to 1:15 p.m. Part 3 will be screening and prevention for breast health. That's Wednesday, October 21st from 4 p.m. to 5:15 p.m. Part 4 will be facts about breast health. And that's Thursday, October 22nd from 4 to 5:15 p.m. And then on Saturday, October 24th will be the Breast Cancer Awareness Symposium from 10 a.m. to 12:30 p.m. And you can register for those at parklandctc.eventbrite.com.
Absolutely. Well, thank you everyone for joining us today. And thank you, Dr. Awasoba, for joining us virtually.
Thanks for having me.
Yeah, thank you.
Thank you.